there are things that
Good evening, everyone. We'll get started in just a moment to give people an opportunity to join us. Welcome, welcome, welcome. Like I said before, we'll get started in a moment to give people an opportunity to join us. Okay, we'll get started in just a moment. Okay. Good evening and welcome to the National Kidney Foundation of Illinois Black History Month virtual celebration. My name is Angelique Marseille and I'll be your MC for this evening. I am the NKFI's program manager. I also recently celebrated 30 years with my liver transplant. Woo! A little bit of history about me is I've worked as an organ and tissue donor advocate for many years, and I currently manage the NKFI's Pandemic Health Navigator program. I'm also a co-facilitator for the Take Charge program, which I'll tell you a little bit more about in a moment. The theme for tonight is Kidney Health for Life. You'll hear from a patient who's on dialysis. You'll hear about the importance of caring for your mental health, and you'll learn a little bit more about how to care for your kidneys by making healthy choices with diet and exercise. But before we move any further, I'd like to thank the generous sponsors who made tonight's program possible. Thank you for Fresenius Kidney Care, Gift of Hope's Organ and Tissue Donor Network, and UI Health Transplant Department. Generous sponsors like these make our work possible. Speaking of our work, NKFI improves the health and well-being of people at risk for or affected by kidney disease through prevention, education, and empowerment. And part of being empowered is taking charge of your health. NKFI hosts a program called Take Charge. It's a chronic disease self-management program where you'll meet with a group for an 8-week, 2-hour-long workshop. And don't worry, I'll be there. This is a program that's free of charge, and it's for participants who are in various stages of chronic kidney disease. You're invited to participate if you have kidney disease, you're on dialysis, or if you have had a kidney transplant. Caregivers and those who are at risk for developing chronic kidney disease are also encouraged to attend. The program covers a range of topics affecting those of us living with chronic illness. From dealing with emotions to getting a good night's sleep, you'll learn how to eat better, feel better emotionally and physically, and most importantly, you'll learn to advocate for yourself so that you are the one in charge, not your chronic illness. So if you're ready to take charge of your health, the next session starts Friday, March 4th at 3:00 p.m. Registration is required, so visit our website to sign up. Feel free to take a screenshot of this slide. My colleague, Sarah Jane, will also put the link in the chat. If you have any questions about the program or anything else about tonight, drop them in the Q&A section at the bottom of the screen. I'm happy to answer them there, or you can email me at amarseille@nkfi.org. Sarah Jane will put my email address in the chat as well. It is now my pleasure to introduce you to our keynote speaker for the event, Dr. April Kennedy. Dr. Kennedy is a clinical nephrologist and hypertension specialist in Chicago with over 20 years of experience in medicine. She's a physician with associates in nephrology. Please join me in welcoming Dr. April Kennedy.
Thank you, thank you. Welcome everybody to this Black History Month webinar. So I couldn't let this opportunity go by without representing my favorite HBCU. I am a proud alumni of Xavier University of Louisiana, and without that education, I wouldn't be where I am today. But let's talk about your kidneys. So what are the kidneys? The human body normally has 2 kidneys. Each of these kidneys are about the size of your fist, and they're located near the middle of your back, just below the rib cage. Even in this picture, it looks like they're floating, but they're actually really tightly bound back there. They don't do too much movement unless they're jarred very seriously. And one healthy kidney can do the work of 2. In transplant recipients, they are usually given one normal kidney. We do not have to transplant 2 kidneys into a person. So how do they work? Your kidney is made up of millions of tiny filtering units. And so blood is pumped out from the heart, it enters into the kidneys, and those tiny filtering units clean the blood. Once the tiny filtering units decide if this is good stuff that it wants to keep in your body or bad stuff that it wants to expel, it'll send it out of one of 2 pathways. The first pathway is into your bladder and into urine. And then the urine is going to pass out of your body. The second pathway is it'll be returned to your bloodstream and go back to your heart to be pumped out as clean blood. So your entire blood volume is filtered through your kidney about 35 times a day. That is about 7 liters per hour. So though the kidney is small, it is working very hard to keep your blood clean. Kidney disease is when your kidney is no longer functioning properly. And it's a serious disease that can lead to other problems, including heart and blood vessel problems, kidney failure, and even death. But if found early, kidney disease can be treated and the progression slowed. So there are 5 stages of chronic kidney disease, and this is important to know because we should all know where we are along this spectrum. So stage 1. That is essentially when you have normal kidney function, and normal kidney function is considered 90% or higher. Stage 2, this is considered mild, what we call chronic kidney disease, and that is when your kidneys are functioning between 60 and 89%. Stage 3 has been broken down into 2 categories. It represents mild to moderate kidney damage. And stage 3 is anywhere between 30 and 59%. And as you can see, stage 3A is a little bit better than 3B with 45 to 59%, and 3B is 30 to 44%. Stage 4 chronic kidney disease is where we are getting into some severe loss of kidney function. And that is when your kidneys are working between 15 to 29%. And then stage 5 is considered kidney failure or end stage renal disease. And that is when the kidneys are functioning at less than 15%. And I just want to say, when I'm speaking about kidney function, we are taking both of your kidneys functioning as a unit. So who is at risk for chronic kidney disease? People who have diabetes are at risk for chronic kidney disease. People who have high blood pressure are at risk for chronic kidney disease. Those are actually the number 1 and number 2 reasons why a person can end up on dialysis. In addition, if a person has a family history of kidney failure, diabetes, or high blood pressure, this puts them at increased risk. Certain ethnic groups are at increased risk just based on that ethnicity, and that includes African Americans, Hispanics, Asian, Pacific Islanders, and American Indians. If you are 60 or older, you are at increased risk for developing chronic kidney disease. And then some additional risk factors can include if you have a history of stones, kidney stones, if you have a history of smoking, if you are obese, or if you suffer from any type of cardiovascular disease. So some things to know. Black Americans are 4 times more likely to develop chronic kidney disease than white Americans. So, that is a huge disparity. Black Americans make up just 13% of the population, but we are 35% of those who have kidney failure. And Black Americans are 2 times more likely to have diabetes than white Americans. Remember, I said diabetes and high blood pressure are the number 1 and 2 reasons why a person develops kidney failure. And almost half of all Black Americans have high blood pressure. So those 2 diseases have such prevalence in the community that they are absolutely driving this propensity to be more likely to develop chronic kidney disease. So why are Black Americans at an increased risk? Well, we already went over the fact that Black Americans suffer from those 2 major health problems at an alarming and higher rate: diabetes and high blood pressure. Kidney disease, diabetes, and high blood pressure are all linked. Uncontrolled diabetes and high blood pressure are significant risk factors for chronic kidney disease. If you have uncontrolled diabetes and high blood pressure, you are absolutely more likely to develop chronic kidney disease than people without these conditions. And each condition can lead to or worsen the other. It is imperative, if you are someone who has diabetes or high blood pressure, that you have them under optimal control. Another reason why Black Americans are at increased risk of chronic kidney disease is genetics and inherited diseases. These can include lupus, polycystic kidney, FSGS, which stands for focal segmental glomerulosclerosis, and the APOL1 gene. So some researchers think the high rate of kidney disease among Black Americans is due to mutations in this APOL1 gene, and that stands for apolipoprotein L1. Everyone has the APOL1 gene, but sometimes it has variations or mutations. And what they found is that Black people who inherit 2 copies of APOL1 risk alleles are at a significantly increased risk for chronic kidney disease. Another reason why Black Americans are at increased risk is social determinants of health and outdated medical practices. And these are things that we often don't have much control over. They could include income, employment, education, housing, insurance status or lack of insurance, access to healthcare, which we know can be challenging for some in these communities, and the EGFR race correction. As of right now, the stand has been taken to avoid the EGFR race correction, and I won't get into that. But when your doctor is calculating your EGFR or that kidney function percent, they are not to take into consideration your race. So diagnosis and treatment of kidney disease are often delayed for Black patients who have poor access to healthcare. It's estimated that more than 30% of patients who have chronic kidney disease haven't seen a nephrologist by the time their kidneys fail. So what can you do to protect your kidneys? Again, I mentioned controlling that blood pressure. That is imperative. You can control your blood pressure by making sure that you're taking in a low sodium diet, taking medications as prescribed by your physician, and exercising regularly and maintaining a healthy weight. Controlling your diabetes, again, imperative. You want to make sure that those blood sugars are good, that you're getting your eyes and your feet checked, and that you're seeing your dentist. And then prioritize kidney health for life. These simple changes can have big results. That prioritization can include flavoring your food with spices, herbs, vinegar, or other salt-free seasonings. Again, avoiding that salt, which can raise your blood pressure. Changing your diet by making half of your plate fruits and vegetables. Choosing lean protein like fish, poultry, and beans over red meats. And then limiting and monitoring your sugar intake. Another thing that you can do is see a registered dietitian. There is a registered dietitian who works with the NKFI. This is her information and phone number right here. Anyone interested in communicating with a registered dietitian should please reach out. You don't have to completely abandon your favorite foods to prioritize your kidney health, but simple swaps can make amazing changes. And again, that registered dietitian can help show you how. Get moving. I had mentioned maintaining optimal weight. You can start with mild exercising for 10 to 15 minutes a day, and then build up gradually to more strenuous exercise. The goal of 30 minutes every day a week. You can do things such as Zumba or jogging once you're ready for that much strenuous exercise. Swimming is also very good. I am particularly suggest that to patients who have arthritis because the water allows for less pressure on the joints. And then you want to extend the time that you're exercising until you reach 30 to 60 minutes most days of the week, as I mentioned just a second ago. If you're at risk, get tested. If any of those things that I mentioned a few slides ago, you fall into those categories, take that seriously and get tested. Even if you have one risk factor, you can request some simple things from your doctor that can let you know how your kidneys are doing. One test is a urine test called the albumin to creatinine ratio, and it looks at how much protein is in the urine. So remember when I explained how the kidney cleans your blood, I talked about that filtering and how your kidney decides to dump the bad and the waste products into the urine and keep the good stuff in your blood. Protein is the good stuff. And we know that when your kidney is spilling protein out into the urine and letting that leave your body, that means that your kidney is letting us know that it's diseased. A blood test to estimate your GFR, or that kidney function percent, can tell you and your healthcare professional how well your kidneys are working. Remember, kidney disease often has no early symptoms. So if you're at risk, the only way to really know is to make sure you're getting tested regularly. The National Kidney Foundation has free kidney mobile screenings. You can talk to your doctor when you want to get your screening. You can attend one of these NKFI kidney mobile events. These events are free, and you can get those screening tests that I mentioned previously done there. The number to call is listed, and you could always check on nkfi.org to find out where the kidney mobile will be next.
Angelique, you're still on mute. Sorry.
Hi, everybody. I'm sorry about that. I was on mute. So thank you so much, Dr. Kennedy. And just to add to that, our first screening of 2022 is happening on World Kidney Day, which is Thursday, March 10th. We'll be at Chicago State University, from 10 a.m. to 3 p.m. screening for chronic kidney disease. And for some of those precursors Dr. Kennedy mentioned. So I'm going to go down to the Q&A. Some of you have already submitted your questions, but if you have other questions about the valuable information that Dr. Kennedy shared, please keep them coming by adding them to the Q&A section at the bottom of your screen. We'll do our best to address them all. Oh, see if we have some questions here. Not quite yet.
Yeah, feel free to ask questions, and everybody, about if you have questions about how kidneys function, what kidney disease is, anything about our programs. We're happy to answer all of those.
Anything about take charge?
Looks like we got one just come in.
I saw that. So we have one question. Why do so many Black people progress to dialysis without knowing they have kidney disease?
I'm not on mute, am I? I'm just making sure. Can you
No.
guys hear me?
Yeah,
Okay.
we can
Yes.
hear you.
Sorry, I just wanted to make sure. So that's a great question. Much of it has to do with the fact that kidney disease does not have any significant symptoms, not only in the early stages, but in the late stages as well. A lot of times the symptoms of late stage kidney disease are what we call very soft symptoms. So it'll be things like fatigue, loss of appetite, a little bit of weight loss. And a lot of times most people shrug this off and they say, oh, it's just because I'm getting older. It's because of ABC. And they don't think about the fact that these things could be happening because there is a disease process going on in their body. You couple that with the fact that in many instances, African Americans don't have the same access to healthcare. They may not be seeing the doctor as regularly. They may not have a doctor that is paying attention. I would say that's likely the main reasons why many African Americans progress to needing dialysis, and they don't know until it's too late.
Okay. Does anyone have any more
We got
questions?
another one in the Q&A, a couple more, it looks like. popping in.
Okay. Let me grab them. Is it possible to slow the progression of kidney disease if you are in the early stages?
Absolutely, and that's the goal of a nephrologist, a kidney specialist. Our goal is not to put people on dialysis. Our goal is to avoid dialysis. As far as the things that we can control and help slow the progression, controlling those disease processes like diabetes and hypertension are key. Controlling the spillage of protein in the urine. We have medications that those would be the main ways that we can help slow the progression. There's also some new medications out called SGLT2 inhibitors, which we're using that have been shown to slow the progression of chronic kidney disease. So the progression can be slowed. We do have options. You just need to see the appropriate healthcare providers so that they can be offered to you.
So I have another question. I've been asked about race as it applies to transplants. Is it true that it is better to receive a kidney from a same person race? Are the chances for the match better?
So I first want to preface it by saying I am not a transplant specialist. But what I do know is that, as you could imagine, when you are looking for a kidney donor, you hear about this process of a match. You want to make sure that the genetic material is very similar because that will decrease the chances of a person rejecting the kidney. So when you think about that, it is more likely that you have similar genetics to people that are in your race. That does not mean that you don't have a good chance of your kidney doing well if the transplant is from someone else, but that's just another factor to consider. When you're being worked up for a transplant and when they're looking at the match between you and that potential donor, they are looking at several different genetic factors, blood types, and all of these things to make sure that the kidney that they are offering to a patient is going to have the best chance of survival.
Are there other causes of CKD?
Sure. There's some intrinsic kidney diseases that can cause chronic kidney disease. We mentioned FSGS, talked about lupus. There's membranoproliferative glomerulonephritis, which is just an inflammatory process of the kidney. So yes, other than diabetes, high blood pressure, cardiovascular disease, there are some other things that can cause kidneys to fail, most of which are intrinsic kidney diseases, or diseases that are just only attacking the kidney.
Another question. If you lose some kidney function, can you gain it back? I.e., if you're in stage 4, can your kidney functions go back to stage 1?
I hear that question a lot because that's what everyone wants to know. If I tell them that they have advanced chronic kidney disease, is that just it? With modifications, if we have points that we could actually act on, again, if your blood pressure is not well controlled, if your diabetes is not well controlled, if you have heart disease or blood vessel disease that we can treat. Well, there are times when we can, intervene on these things and help improve kidney function. You are likely not to see huge jumps as the person who asked described, going from 4 to 1, not likely. We might be able to get you from 4 to 3, especially if you were higher in the stage 4. Your kidneys are not like your liver. You've heard, you can transplant a piece of a liver and then a full liver will be there. Kidneys don't have that ability. So we normally do not expect such huge improvements in kidney function, like from a 4 to a stage 1 with treatment.
Oh, okay. So can a person be put on dialysis for short term?
Yeah, it all depends on what the reason for the kidney failure is. So sometimes if you have some of those temporary things like a bad infection, or you're acutely ill, maybe you had a heart attack recently and your kidneys are suffering because your heart's not functioning or because you have inflammation all over your body, short-term dialysis might help support you until your kidneys kick back in. Now, when we're talking about more chronic kidney disease or kidney disease progression that's been going on for some time, that's less likely to be remedied with short-term dialysis, and those patients tend to require dialysis until a transplant is able to be performed.
Okay. We have a question. Who should see a nephrologist? Should a patient with stage 1 chronic kidney disease see a nephrologist too?
It depends on the surrounding factors. If you're someone who is very, very high risk, if you're an African American, you have diabetes and high blood pressure, you have a family history of someone being on dialysis and chronic kidney disease, then I would say yes. Even if you're in a high stage, it would be a good idea to see a kidney specialist just to make sure you have the right test performed to make sure that you don't have any protein in the urine, or that your kidneys do look healthy when we're performing an ultrasound. So in particular, if you're someone who has several risk factors, I don't think it's ever too soon to see a kidney doctor.
How can family members help support a kidney disease patient? How can they help or help support? Go ahead.
I think the best thing to do is find out what they need. Sometimes depending on where they are in that journey, if it's someone on dialysis, dialysis can be quite life-changing. So you need to find out what that person needs to feel more normal. If it's someone who just has chronic kidney disease and it's being treated, helping them make good decisions, helping them make those healthy decisions that can prolong the life of the kidney, I think are going to be best. And then, you know, just listening to what they have to say and how they feel about having this chronic illness. Chronic illness is very difficult to grapple with for most people.
Okay, we have a few more. Have you seen a significant rise in kidney disease due to increased drug use?
I personally cannot say that is the case. You know, even the patients that I see who do have significant drug use history, a lot of times it's some other confounding factors that likely led to their kidney failure, or, you know, or their kidneys being damaged.
We have one comment in the chat I wanted to point out real quick. I'm sorry, Angelique.
Okay, go ahead.
Amika says, some doctors don't discuss the blood and urine results with the patient. What would you suggest if someone's going to their regular physician that they should ask for, say, to know their risk?
Yeah, so first you want a urine test performed, and you want to know the results. Always ask for copies of your results, or, you know, to be shown. A lot of places have electronic medical records now, and you can sign up and you can actually see your results yourself. I think that's important. If you are able to do that, do. But, you know, your urine should be checked. You should have a chemistry panel or a metabolic panel that always has your kidney function in it. It also has your blood sugar. Those are the main things. I hope I answered the question, but those are the main things that you want to make sure your doctor's doing. And, you know, never be okay with not knowing the results of a test. And you want to know specifics. You don't just want to hear it's normal. You want to know, what is the GFR calculated to be? What did the urine show? You know, don't just accept it's normal. You want to see the parameters yourself.
Yeah, I think that was helpful. Sorry, Angelique, I'm going to do this.
No, that was very helpful. No, I just got another question too in the comments.
Oh, okay. You want to read the one from Miss Espinoza in the comments, or I can read that one?
You can read that one.
By the time you find out you have kidney disease, is it too late to do anything to keep you off dialysis? And she adds, HBCU rocks, SU Southern Baton Rouge.
Both of my parents graduated from SU in Baton Rouge.
Hey.
And the question was, say it again for me.
By the time you find out you have kidney disease, is it too late to do anything to keep you off dialysis? Oh, no, absolutely not. I mean, early detection is key. I mentioned all those things. There's medications that we have. We can do kidney biopsies to make sure that what we think is the problem, so that we know that we're treating things appropriately. So no, I don't think it's ever too late to have that workup and to make sure that we're doing all that we can. Again, our goal is to stabilize and get some improvement if we can. So we will always try to do that.
There's another question. When you have an annual exam, do they automatically check your kidney functions? That's a good question. Yes.
They should, yes. You know, the basic annual blood work almost always, and if it doesn't, it should include that chemistry panel. In that chemistry panel are your kidney function numbers, or a basic metabolic panel, or a complete metabolic panel. All of those have your kidney function numbers, and that is checked on an annual basis.
Okay, and the next one, I think I myself or Sarah Jane can answer this one. How can people support the foundation or get involved?
We also have Jackie on the line if she wants to jump in after that one.
I think that'll be perfect.
Oh, maybe not right now. I know she was on 2 Zoom calls at once tonight, so she might be having to be involved in the other one right now, but you go. Oh, there she is.
Hello.
Hi, Jackie.
Hi, Jackie.
How are you? Thank you again. Thank you so much, Dr. Kennedy, and thank you, Angelique. So the question related to being involved, how to get involved within KFI. Oh my goodness, how much time do we have? How much time do we have left available? in terms of with our screenings, with our events, and with our programs, depending on the background. Also, we have our Living With series, for patients and families that have been impacted by kidney disease. Our event, I would say our large community event is our Walk for Kidneys. And we're very excited. That's going to be in June, on June 12th at the Diversey Harbor. So there are multiple ways to get involved. In fact, next week we have a kidney patient summit. So advocacy, which is the empowerment component of our mission, is another way for everyone to get involved. So with that, what I recommend, we go to the website, www.nkfi.org. We also are very active on social media. I know a lot of that was posted at the end of the presentation, and we welcome all involvement in all areas. I didn't know how much time we had, so I didn't want to go into my 30-minute presentation, but
we've still got some time. Our patient, I think, is still on the radio, so we've still got a little time while we wait for him to join us. I know there's a couple more questions, but
yes, okay. There is.
Wanted,
Dr.
Yeah.
So I'm going to close out on that. I really direct people to our website, to our phone number, 312-321-1500, as another example. And we really welcome your participation. Our theme this year for awareness is Kidney Health for Life. You saw that. And we are very serious about that and really making a difference in changing the trajectory of kidney disease toward kidney health. So Sarah Jane, with that, I'm gonna go out and then so that the other questions can be addressed. I hope I addressed the questions that as it was positioned. Okay,
yes, thanks for stopping in.
Thank you. Thank you. So we just have a few more questions, Dr. Kennedy. So one of the questions is, how has COVID increased the number of people with kidney disease?
COVID has increased the number of people with kidney disease. I won't get into on the cellular level, what they found. There's been, some trials of biopsying COVID patients who have suffered from acute kidney injury, to see the etiology. As you can imagine, that literature is not voluminous. But absolutely, we see acute kidney injury in COVID patients. We see an increase of need for dialysis in patients that have COVID, especially those that are critically ill. We've termed it COVID nephropathy. I have not seen anyone recover from it as of yet, but it's relatively new, so I just don't think we have enough time to see it spread out. But yes, definitely with COVID, there has been an increase in kidney failure.
Wow. So we noted that a nutritionist counsel, but are there any foods that patients with CKD should try to stay away from?
There's only certain foods that you might have to stay away from, depending on what your blood results will tell you. So, I don't want to tell anyone to, do XYZ diet unless they have to. You definitely want to have a heart healthy diet, low sodium, low bad fats, low cholesterol. There's other things like potassium, phosphorus, and calcium that we do have to take into consideration with patients that have chronic kidney disease, but it is on a case-by-case basis. So I can't make a blanket statement. I would have to, or a physician would have to look at your blood work and see if any of those numbers are outside of the normal ranges.
And we have one more so far. I know there's some in the chat, but if blood pressure medication is attributing to kidney disease, what types of things can be done in that case?
I read that, and what I wanted to ask was what blood pressure medication is the person speaking of? We don't have blood pressure medications that actually directly attribute to kidney disease. We do have some blood pressure medications that we try to be sure to put kidney disease patients on because they're actually helpful. Now that being said, There are some instances where these medications, if you are acutely ill, or if you're going to have a specific type of procedure, we don't want you to take them, because the combination of that acute illness and the medication, or something that you might be giving during a procedure and the medication, can temporarily cause harm to your kidneys. But there are no blood pressure medications that just in of itself, have a direct bad effect on the kidneys. I think that's what the person is getting at, but that's not the case. I would be interested to know the medications that she's speaking of, so I can better understand what the confusion is.
Okay, and then there was another one that said, is chronic kidney disease hereditary? I think you spoke a little bit on the slides about that.
It can be. It is not always, but it definitely can be. If you have that family history, you are at increased risk.
And I have one more question. You can just keep coming. Thank you so much for being patient, Dr. Kennedy. If someone wishes to become a living donor, where do they begin the process?
If you already, have identified a person that you would like to donate to, then you and that patient just need to pick a kidney transplant center and go in for the workup. Now, if you want to, for lack of a better word, randomly donate a kidney, you can still do the same thing. If there's a hospital system or a transplant center that you're familiar with, you can let them know that you're interested in being a kidney donor, and they will perform that evaluation and give you that opportunity. There's a lot of interesting things that they do, like kidney swaps, where one person might have a family member who wants to donate, but it's not a match for them, but it's a match for another person, and they'll do a swap between donors and recipients. So there's a lot of unique ways that we're trying to increase the ability to get donor kidneys into patients. So if you're interested, just reach out to the transplant center of your choice.
One interesting question. So this one says, how fast can you progress from one stage to the next? Example, how do you go from 2 to 3? Like, is it a time frame or is it overnight?
It's a relatively slow process. It should be a relatively slow process. Outside of having those illnesses that are speeding up the process, you should probably lose, less than 1% kidney function, or about 1% per year, if that. But what we see is when you put together just the natural fact that over time kidney function declines with diabetes and high blood pressure and other chronic problems, you see it go faster.
Okay. And is there a better test to get to? Is it urine test or a blood test for kidney disease? Like which one a person should go in and ask for first, like the urine or the blood?
So you want to have the urine, you want to have the blood test performed so they can calculate your GFR, or that kidney function percent. So you want the BUN and the creatinine. We use that creatinine to calculate that GFR. And then you want the urine test too, because the urine really tells us what your kidney is putting out and what's in it. And if there's anything abnormal in that urine, that's helpful when we start trying to pick out differential diagnoses. So you want the blood test for the creatinine, and you want a full urinalysis.
Okay. And then what age should a person be before they start, or you start testing them for kidney disease?
I would not suggest, any age weight, and particularly if you're in any of those groups, if you're African American, if you have a family history, if you have any of those diseases, you should see your physician on your appropriate schedule. I mean, most of us, even when we're young, the recommendation is that you see a physician every 1 to 2 years. Now, most people don't start doing that until, they're well into their 30s or 40s, because we feel like we don't need to. But I would suggest that you keep regular tabs on yourself with your physician as early as possible.
Great. Great. I think that is it for the questions. I think we had one, but that was it.
We're still waiting for our patient speaker to join us, but I don't want to hold up the whole operation. So I'll go ahead and we can talk about some of the other things before we can highlight our sponsors again and talk about some of those places where people can find us while we wait for him to join us.
Okay. Okay, well, first of all, thank you again, Dr. Kennedy. Thank you so much for that. But that's all we have time for right now. We don't want to keep Dr. Kennedy here for too much longer. So Sarah Jane is taking note of the questions that we haven't answered yet, and we'll follow up with those commenters individually. So as soon as our host gets on, I will introduce him to the platform.
Do you want to go ahead and talk about the stuff at the end about thanking our sponsors and some of our where
Sure.
they can follow us, that sort of thing? And hopefully he'll join us in just a second.
Okay. So I want to thank our sponsors again before he joins us, which is the Fresenius. I promised I wasn't going to mess it up all night, I swear. Fresenius Kidney Care, Gift of Hope, Organ and Tissue Donor Network, and UI Health. Those are our sponsors that made this program possible. And also you can follow us we encourage you to follow us on our social media and check out our website for frequent updates and information about all things kidney health. And again, I want to thank you for joining us for tonight for our Black History Month virtual celebration of Kidney Health for Life. And again, we're all looking forward to our next speaker. His name is Atiba Buchanan.
Hi, can you guys hear me?
Hi. Yes,
Oh, wonderful.
yes. Thank you for joining us. Let me give you a proper introduction. Hold on. So Atiba is not only a fantastic radio host, he's also a father, a kidney disease ambassador, and he is currently on dialysis. So let's all welcome Atiba Buchanan.
Hey, good evening. Thank you for having me. I apologize that I'm in the car. I thought I could come on at 6:30. The show just ended and I had to drop off my producer at the train station. So I was headed back to the station to join the call, but Ms. Fox informed me that you guys needed me right now. So that's why I was calling from the car.
No, that's fine. Thank you so much.
Yeah, no problem at all. I'm always glad to do whatever I can. So what can I tell you today? What is it? What am I breaking down?
We would love for you to share your story.
By all means, I'll do the, in the interest of time, I'll try and do a robust version, but still yet truncated. So I am 48 years old. I have been dealing with kidney disease since I was about 27. Basically, long story short, I got diagnosed because I had undiagnosed high blood pressure, was having headaches for days and days and days, and I would take Excedrin every day and not go to the doctor. One night, I was eating a Polish, 1,000 milligrams of sodium. And after I'd eaten this Polish, I basically blacked out. I was able to tell my wife right before I blacked out, my then wife, hey, you need to call 911. She did. When I came to, paramedics were there. They took me to the emergency room where the doctor assumed I was on drugs. And she asked me what kind of drugs I was taking. And I could understand her, befuddlement because I'm 27 years old. At the time, I'm a very avid weightlifter. I'm in really good shape, at least aesthetically. And so I'm like, hey, I'm not on any drugs. I wish it was that simple. And she goes, well, we're going to find out, right? I was like, oh, you're serious? Okay, no, I'm not on any drugs. I get admitted. my blood pressure that night was 230 over one something. I want to say it was like 120, something in that range, but definitely potential stroke material. And I was very grateful that I didn't have a stroke. They thought I had a heart attack, but that wasn't it. It was just really, really high blood pressure that laid me out. After being in the hospital for a day or so, my primary care physician came and he explained to me that I had lost 80% of my kidney function based on all the blood work they had done, and that I would have about a year and a half before I would need a transplant. And so that's how I lived my life. For the next year and a half, I worked on getting a kidney, which I was able to do through a living related donor, a first cousin who was an O blood type, and he was able to give me a kidney that lasted 5 years. The operation was in May of 2003 at UIC, and then sometime in late 2008, the kidney began to fail again. My official diagnosis, by the way, is FSGS, focal segmental glomerulosclerosis, which basically means it's idiopathic. They don't know why my kidneys don't work. So all that said, that lasted about 5 years. In that year and a half that I was pursuing a kidney, I was never on dialysis. And not only was I never on dialysis, I really didn't feel bad. I never really felt sick. I just trusted that my kidneys weren't working because everything else still was. I was still urinating, all those things were pretty normal. But when that transplanted kidney began to fail in 2008, it hit me, it hit way different. The biggest thing was I was anemic and I didn't know it. And that's what really made me go to see my nephrologist. I was tired all the time. I could not walk a flight of steps and I was incessantly cold. So much so that when I was working, we had the, you have Secret Santa at work. My Secret Santa bought me a space heater because I was always complaining about being cold. So I go to see my nephrologist, this time at a different hospital, and I get blood work done. And I'll never forget this. He says to me, I don't know how you're walking around. You literally have half as much blood in your body as you're supposed to have. And you need to get on dialysis yesterday. Now, it wasn't an emergency situation where they had to go in through my neck. So we did go ahead and plan out the fistula. I had the surgery in January of 2009, and I began dialysis in April of 2009. About 3 months later, the vein was mature enough to begin dialysis. And that was the beginning of my dialysis. Within 2 or 3 sessions, I began to feel remarkably better. At dialysis, they give you the chemical to help replicate your bone marrow to make more red blood cells. My hemoglobin went up. I began to have more energy. I wasn't as cold. And dialysis has been the best thing to happen to me in my life. It has given me an additional, what's going to be 13 years in April with my wife, then wife, and my children who are now 23 and 21. And it has been a tremendous blessing. I thank God for it every day. It'll be 13 years. It's still, I went to dialysis, what's today? Thursday, yesterday. So I'm on Monday, Wednesday, Friday at 4 in.the morning. And I do it right now with my current job on the radio. I do it with my side catering business. I make it work because it is just a blessing. I always say Walter Payton had no dialysis option for his liver failure. And there are people that literally would, have died because they don't have this option. So I have never viewed it as a burden. I've never viewed it as a problem. It is only and always will be a blessing to me. Is that short enough?
Okay.
That was great. Thank you so much for sharing that. Really appreciate it.
Yeah.
Yes,
so
it
I mean,
was.
if I have to just make sure that one impression, go visit your doctor regularly, get regular checkups. My biggest thing in all this was that I had a symptom that I was ignoring for months, and this is how it turned out. Who knows what would have happened had I gone to the doctor when I initially began having headaches, and or if I was having regular doctor visits to catch this early. So that is the thing that I always want people to take away from my story.
Very, very important.
Well, Atiba, thank you so much for joining us. We really appreciate your time, and I'm sorry about the mix-up. So
yes,
thanks so much.
Thank you
no
so
problem.
much for joining us.
Anything I can do for you guys, I'm always here. And please listen to me every day, Monday through Friday, 3 to 6 on WVON if you get a chance.
Yes, thank you again. And stories, thanks for sharing your story with us. It's so important to hear voices like yours. And before we get out of
absolutely.
here, yes, thank you.
Oh, we
I
have
wanna
one
thank our-
commenter who wants to talk, who wants us to review the dietitian information. Are you okay with doing that
Oh.
real quick?
Sure.
Okay.
Where is it? You gonna put the slide up for him? For her?
Yes, I'll put that up. Just a second. Let me get back to it. There we go. And I will drop her information in the chat as well, Dr. Melissa Prest. You can set up a free consultation with her via email or phone, which Monica just put in the chat. And she's happy to talk to anybody in any stage of chronic kidney disease, post-dialysis or on dialysis, post-transplant, or even if you're just looking to prevent kidney disease from developing. She's also worked with potential living donors to help them get ready to donate. All right,
Thank you.
Sorry, Angelique, I'll let you take back over from here.
No. Thank you so much, Sarah Jane. Thank you. I appreciate you putting her back up there for him to screenshot that. So again, I want to thank our sponsors again for their support of this program. And on behalf of all of us at NKFI, I want to thank Atiba and Dr. Kennedy once again for spending this time and sharing their insight with us. And again, we encourage you to follow us on social media and check out our website for frequent updates and information about all things kidney health. Thank you so much for joining us tonight for our Black History Month's virtual celebration of kidney health for life. So we have a few minutes left. If you guys have any more questions you wanted to ask before we really get out of here, just let me know. We're actually going to leave the logo up for a while so you can get all the information off of it. Let's see, there was one question. Nope.
I think we got to that one. That was, but
Yeah, we did. I
wanted
just
to make
looked at
sure
it.
you saw, Angelique, all the
Yeah.
kudos to you in the chat.
Oh yeah, see that? Thank you. Thank you, everybody. This was great.
Thanks so much for joining, everyone. I'm going to close down, but we'll have this recording saved to our website and on social media. So if you want to share it with anyone, you can feel free to do so. And we hope to see you all on World Kidney Day.
Yes, thank you. We'll be looking for you.